what we were trying to do is a comparative analysis, looking at the 2015-16 El Nino and its response, and then the next one, which was 2023-2024. The idea was to see what gaps were there in the responses and in the planning. Are there any links that were overlooked? Were there lessons learned in the first El Nino that were or were not applied in the second one? And really come up with actionable insights and lessons learned. Here on the right, you see the list of countries that the study focused on, all in Southern Africa. And it's important that 6 countries in the region declared a state of emergency due to the El Nino-linked severe droughts. So when a country declares an emergency, a response is triggered. And so this is a very important factor analyzing an emergency response after. So what were the 2 El Ninos compared to each other in terms of severity? Because no El Nino, it's, as I said, a complex phenomenon, is fully comparable. So you see here that double as many people were affected and in need of attendance in the second one compared to the first one. While the first one was actually classified as a very strong El Nino in terms of the weather phenomena, and the second one was climatically weaker, the second one still had a more severe impact. So it was more widespread, which often means that if you have a drought and then a flood, the countries, the systems, they don't have enough time to put the structures back together. So the widespread impact, having more countries affected, having actually compounding crises happening, actually led to the second El Nino having a worse effect, which is also reflected then in the level of humanitarian appeals, like the funding requested for humanitarian assistance in order to deal with the impact. In terms of food insecurity, the levels, the 2 El Ninos were actually comparable. I want to add another element here. So our study and also other partner studies have found that droughts have a very specific impact in regard to HIV. So we have seen numbers ranging between 11% and 15% in high prevalence rural settings of HIV transmission after a drought. So it's important, this specifically impacts the HIV risk of women, driven by food insecurity, by early marriage, and by transactional sex. And I do just want to give the specific caveat. This is for drought impact. This is not emergency impact overall, because here there's quite a few differences between the different emergencies and what results they are leading to. So here I'm gonna dive right into the recommendations and lesson learned. Please. So I want to start with preparedness. So we have seen that preparedness has heavily improved between the 2 El Ninos. So, for example, FEVSNet, the Famine Early Warning Systems Network, was used at the second one to issue bulletins that focused on the El Nino risks, and really showed a very and yeah, it really showed an improved approach to risk communication. What has become quite clear is though that early warning systems have to be sector specific, so in order to be turned into early action. So just the warning won't be enough. It actually has to be specific enough. For example, also be translated into local languages in order to trigger action. So you can see here preparedness has improved, but we have to say still it is not at all on par with the needs that we're seeing in the second El Nino. And so our future focus and our recommendations are to really improve early warning systems, integrate HIV and SRHR into anticipatory action plans, and develop a standardized cross-sector preparedness tool so that that really HIV and SRH get a part of the response from the beginning, from the design phase, and not later on. So coordination has improved as well on regional level and on local level and across various partners. So in the slide before, I didn't say it, but I mentioned the SADC phase plan before that really helped the preparedness phase. SADC's plan, a very strong relationship between SADC and OCHA here through RIASCO, the Southern African platform of humanitarian partners led by OCHA. This has really been described as a massive success to create a timely and effective drought response across sectors. However, it has been said that this has worked best during the height of the emergency, while it actually trickled out afterwards. So when, for example, as I said earlier, a national emergency was declared and there was a lot of momentum. This collaboration worked really well. It didn't work so well in between the higher levels of escalation. But nevertheless, there was a clear improvement, specifically linking government and humanitarian partners. One area of improvement was that we've seen that district level partners are very crucial for an effective response. However, they are not always brought in early enough and also not capacitated enough. For example, in Mozambique, there were HIV focal points for emergency situations at national government level, and this really helped to have concrete people to hold the threats together and align the different sectors. So yeah, in terms of future focus, it's clear that there's a need for specific guidelines on HIV integration. I'm happy to say that we are revising the HIV and emergencies guidelines from 2010. This is done by the Interagency Task Team on HIV and emergencies, led by WFP, UNHCR, and UNAIDS on global level. It's crucial to mainstream HIV into climate preparedness and emergency response plans. We need to work both across sectors as well as with technical staff within a sector to root the topics well. And again, there needs to be clear communication across the various stakeholders. Because what we've still seen is if that doesn't exist and if there's not enough time to prepare, administrative processes can be a massive barrier. So this one is on innovative care models and actually very exciting. And this, there were so many interesting examples found that we decided to do another study trying to find models and templates for HIV integration in humanitarian settings. So just to mention a couple, clear success was shown through 6 months, multi-month dispensary. That means if somebody, for example, loses their drugs or loses access to their drugs, this can be improved, giving out more at once. There were various models of mobile clinics which clearly improved access to services, especially in remote areas. And there was an example from Zimbabwe where HIV outreaches were conducted in communities and included providing supplies for viral load testing. So this really helped to link specifically with households that are vulnerable to food insecurity, to identify people living with HIV, and then provide them with livelihood projects and food supplements. And this was largely done through community actors, which I think is another cross-cutting lesson learned. Community actors are what link the humanitarian coordination with the people in need the best. Yeah, I think this covers the future focus as well. There were issues around stockouts and ART and SRH commodities overall. And a clear lesson was that if service models are decentralized and community-based, they work better. Talking about the stockouts, there were issues with climate resilient storage facilities overall for commodities, and that is definitely another area to invest in heavily. I do want to dive a little bit deeper into HIV nutrition integration. Next slide. So what worked well here, we learned a lot from a well-documented example. It was a PEPFAR WFP collaboration in 2015-16, where HIV was linked with nutrition. So for example, they managed to advance equitable HIV-sensitive programming by actually targeting malnutrition rather than HIV status, and integrate HIV screening in the rehabilitation programs. However, these integration models also come with risks, right? So for example, one issue was the increased workload for healthcare workers if the nutrition part was integrated in the health sector, or for example, when there was the attempt to link the distribution of both food and HIV supplies, it can be very challenging to actually align those schedules. You can imagine in a humanitarian situation, the distribution of commodities and sticking to schedules is already a challenge. So if this is then has to happen across 2 sectors, which are not linked, this can be incredibly challenging, both in terms of distribution, procurement, storage, and hence one of our recommendations is to create digital supply chain management systems that integrate across sectors. And this issue of data is something I'm going to come back to a little bit later. So another deep dive into integration of HIV is another sector that is very promising. This is gender-based violence response and prevention. So we've seen generally gender-based violence has played a much bigger role in the second El Nino. So for example, some participants from Malawi actually mentioned that there were even more actors working on this topic, and that community vigilance was heavily increased because there were so many actors from government and civil society that brought this topic to the forefront. There was an interesting example from Zambia that focused on addressing gender-based violence through decentralized services. So what they did is they worked with community health workers that they trained as GBV monitors. They identified and supported as at-risk girls and women over a long time, empowering them through local intervention, linking with food parcels, and really fighting the issue of gender-based violence through a very comprehensive, multi-sectoral way. Obviously, there's challenges with this intervention. Clearly, GBV itself should actually be integrated across various sectors because as a social issue, it has to do with many of the sectors involved in a humanitarian response. And there were obviously issues with funding that is specifically dedicated to support vulnerable groups in gender-based violence prevention. I want to talk briefly about community engagement. I've said that before. It's clear that community-led interventions are crucial. However, it is even difficult to find data on these interventions. That shouldn't say that this didn't happen, but it means that they weren't documented or that this data wasn't accessible afterwards, which is such a pity because we know that through the humanitarian reset, the hyper-prioritization that we are seeing right now happening in the sector, community-led responses are being prioritized. But if we don't have great examples to learn from, we are really missing out here. There was an example of very effective community-based initiatives where community support volunteers who were themselves people living with HIV checked continuously on 10 other people, like a snowball effect, to make sure that they would continue treatment, and really this helped to share medications and improve retention on care. However, there were lots of interesting examples. We had quite a few youth respondents in this work, and one thing that came out clearly is that youth, just like any other more marginalized population, will have even less access or less of a role to play in the humanitarian response than communities in general. So a clear recommendation for the future is to improve meaningful community participation before, after, and during responses. This means we have to invest in community structures before an emergency hits, because when an emergency hits and social structures are being destroyed, this will be even harder to engage. My last area of lessons learned is on data. I've mentioned this briefly about linking nutrition and HIV supply chain management. So I don't think this is a surprising issue for anybody, but nevertheless very difficult to tackle. There's such a problem with data on HIV and emergencies. I think any kind of data system is difficult in humanitarian settings, but HIV is not integrated, it's neglected, and even if there is data, it won't be accessible after. So this is really a huge call to develop data platforms that work for real-time information sharing and to strengthen data collection systems to link across sectors, specifically HIV and climate-related indicators, because it is difficult to make an analysis of HIV transmission rates if they're not directly linked to indicators displaying the context of climate change. I do want to say, though, that there were quite a few new platforms and initiatives and tools developed and implemented between the first and second El Nino, and that this has improved a lot, but nevertheless, it remains a major challenge. What is the outcome? What is our main thinking of this topic? So it's clear that there's a huge need for a better integrated multi-sectoral approach to make sure that HIV is integrated, but also that the progress we have made on HIV over the last decade is not getting lost, because right now with the changes, with the shortages of funding, it will become harder and harder to advocate for this often deprioritized issue. It's important to really link HIV and SRHR mainstreamed into climate change adaptations, And our path forward, the advocacy stemming from this topic, from the study, is really sustaining political will, making sure that these topics are integrated across all phases of emergencies, keeping the commitment high to community engagement, and making sure that we find a multi-sectoral approach to HIV integration, because really, like, working in silos is absolutely not the right way to do things anymore, but we still tend to do it, especially when time and funding is scarce. So yeah, I urge us all to work on this topic, to not let it slip through the cracks, and I'm really excited for this to improve our collaboration. So thank you for giving me the floor.
Thank you so much, Merit. And with that, we close the second session of Fresh Insights. Thank you, everybody.